Welcome to my YouTube channel. Today we are going to discuss and talk about the main difference between a psychologist and a psychotherapist, psychiatrist, and a counselor as well, so that people can choose wisely and understand what is the role of each profession. Because all these professions, their names start with the term psych, so many people confuse themselves in between what is a psychologist, a psychiatrist, a psychotherapist, and a counselor. So let us begin our talk and see what are the main differences between them. And the main purpose of today's talk is that I have received many questions on my Instagram, that what is the difference between a psychiatrist and a psychologist? Are they the same, or is there any difference between them? Because there is very less awareness about this in our society and our country as well. So we have to acknowledge it, and I am here to tell you the difference now so that it can be helpful for you. So let us begin. It is very important to talk about this because there is a huge difference between a psychologist and a psychiatrist. Plus, we will add in our talk what is a psychotherapist and a counselor as well. So first of all, we will discuss that what makes a psychiatrist. A psychiatrist is someone who already holds a MBBS degree. He is already a professional doctor, yet he later on specializes in the field of psychiatrist, which makes him a professional psychiatrist then. But if we talk about a psychologist, he has a Bachelor of Science degree, which he does from the start. So that is the main difference between a psychiatrist and a psychologist, that they have different degrees and they relate to different things as well, which we will discuss later on. The second main difference is that a psychiatrist is someone who prescribes medicine to his patients. After identifying the disorder, he refers his patients different medicine according to their disorders. But a psychologist is someone who does not recommend any medicine. He is someone who will refer you to a psychiatrist for medication if he thinks that you need it. Only then he will refer you. A psychologist is someone who takes sessions in order to resolve a disorder or any other issue in a natural manner. These sessions do take time. It is time taking, but it is good for the long run and is much better than taking any medicines. If you are able to resolve your issue without taking any medicines, then what else would you require or want? A psychiatrist's job is to identify the disorder. For example, if there is a neurodevelopment disorder, then it cannot be fixed by any medicine because this is something you get by birth and can be only fixed by a psychologist in his sessions that you will take, and not by any medicine. So the psychiatrist would identify this disorder, and he will see that only a psychologist can fix this problem. So he will refer you to a psychologist, and then the psychologist will, by the help of his sessions, will continue to make the disorder much better than it was before. One more thing I would like to clear is that in our country, Pakistan, many people have portrayed psychologist as someone who only treats those patients who are mentally upset or are completely mad. But that is not the case. It is totally a opposite of it, as anyone can come and see a psychologist and give them their issues, and then they will see that through the sessions they take from a psychologist, their issues will get resolved time by time during those courses they take in those sessions by a psychologist. But people here complain that our families don't let them go to a psychologist because they think that sending them to a psychologist is like sending someone who is mad, which is totally wrong and is not good for the patient as well. If patient is facing any kind of problems with mental health, they should first go towards a psychologist because they go to a psychiatrist without any hesitation, as people think that psychiatrist is a good and better doctor than a psychologist. So he is a good doctor, but he is only there to refer you or give you medication, but he cannot resolve your problems, daily life problems, or anything else related to mental health. So you have to first go to the psychologist to confirm that whether you have the thing that you think that you have, and which medication you need. So after that, if you have to go to the psychiatrist, your psychologist will let you know that. So it is very much important to clear this thing that all people think regarding psychologists. If you know a person who doesn't know the difference between a psychologist or a psychiatrist, or anyone of your friend or relative or anyone you know is facing through some mental health issues, you have to make it clear to their families or anyone who is stopping them that there is a huge difference between a psychologist and psychiatrist. Stopping someone to go to a psychologist is like doing something very bad to them, more bad to them than their current situation. So it is always better to go and see the psychologist first. And please share this video as much as you can so that people can be well aware of this and they know the difference between a psychologist and a psychiatrist too. 20 to 30 years, this was the same thing there was very little difference between a psychiatrist and psychologist at that time. But now we only see a psychiatrist recommending, writing prescriptions, and giving you the medications that you need. But a psychologist is someone like a counselor that he gives different therapy sessions to you, which are much more better than going straight for medication. So you have to know the problem first and then go for the medication if that is needed. And if we talk about opportunities, psychologists have more opportunities than a psychiatrist. You will see a psychiatrist only working in a hospital mostly or in their own personal clinic, but a psychologist is available everywhere. For example, in the university or any social health center, anywhere there where help is needed mentally and physically, you will see the psychologist there. By physically, I mean in if we talk about a cricket team, there is also a psychologist for them as well at that time because they have different situations in which they can get stress and feel not good about the game. So the psychologist is available there to motivate them towards the game. So wherever there are many other aspects where you will see that the psychologists have more opportunities than a psychiatrist. Psychologists have many different jobs. There are child psychologists, school psychologists, and health psychologists. There are many different fields in psychology as well, whereas psychiatrist is only related to prescribing medications and identifying disorders. So psychologist is much more wider than the psychiatry. If we talk about psychotherapist, we will begin by knowing what psychologist is. A psychologist is made up with many years. It is not only that you take some courses and become a psychotherapist in 2 weeks or a month or 3 months. To become a psychologist, you have to go through an extensive time and you have to get those bachelor and doctorate degrees. After that, you are professionally a psychologist, called a psychologist. So, with that said, psychologists are much more uh, of psychotherapy, more educated than psychotherapists in their field. They are also called psychotherapists too. So with that said, you will definitely know by this time that psychologists are also psychotherapists. They are more professional in talking than a normal psychotherapist. So there's a huge difference between them too. Exception, the only exception for a psychologist there will be that if he decides to go on the route of research, so then he will not be a called a psychotherapist because he then goes towards the research route. So that is the only case where a psychologist cannot be called a psychotherapist. This does become confusing because psychologists and psychotherapists kind of do the same job particularly, but there are some exceptions. Psychotherapists can usually not diagnose the full range of disorders that people experience, but there are psychotherapists who specialize in CBT, cognitive behavioral therapy. CBT can actually diagnose anxiety and depression. There are limitations, but you will get a good quality of talking from a psychologist than a psychotherapist within the areas of his expertise. Then we get the term counselor. A counselor is someone who has taken some basic counseling courses. They have been trained in some kind of talk therapies, but they are not qualified or trained in using specific evidence based type therapies. They can hold someone in therapeutic sessions. They know the professional boundaries. They have got very good skills in terms of offering empathy and understanding. But in terms of actually offering strategies and offering approaches that are in line with the research, your counselor is just not going to go to that level or that area of depth in that case. You will get great listening, you will get a nice therapeutic experience, but you are not going to get that something that is highly proven, highly researched, and highly evidence based that will help you in a specific problem. But I will give you one advice. People say that they want to see a psychiatrist, but they actually want to see a psychologist, vice versa. We really need to educate people and we really need to talk about what their real needs are so that we do not end up prescribing medications which can be much better done by taking therapy sessions. So, running after short term solutions is like going straight towards the medication. But if you want a long term solution, you have to get those therapy sessions from a professional qualified psychologist. But medications, as taking medications as the first uh, way to go to, is like going into a very dangerous place because then you end up depending on medications while you really do not need them. And this is something we see normally in anxiety disorders. I've seen many people getting different medications while they actually only need cognitive behavioral therapy from an expert in CBT so that they can overcome their difficulties without relying on any medications, which is something very good and beneficial for any person who is facing these problems. So I hope that everything is clear now. You have understood all the terms, the psychologist, the psychotherapist, the psychiatrist, and the counselor. And so, if you have any questions, you can write them down in the comment section, and I will be very happy to answer them for you. And if you like this video, click on the like button. And if you want to see more of my videos, subscribe to my channel and press the bell icon so that you do not miss any videos that I'm going to share in the coming days as well. Thank you for watching and share it with as many people you can because that is the only way we will spread this awareness and make things clear for the people who do not know about these things, these terms. So, thank you for watching.